We continue with the next speaker. The next speaker on podium would be a first year student, Prashant Jagtap. Prashant Jagtap is a first year student pursuing MA in Hindu Studies. He's a trained physician before coming to Nalanda. Prashant Jagtap has also served as a government medical officer with the Government of Maharashtra and also as an Assistant Commandant in the Indian Armed Forces, demonstrating his commitment to both public health and national service. He also mentored hundreds of aspirants to be officers in Armed Forces of India and even authored books for competitive exams for McGraw Hill India. Can I have a huge round of applause for Prashant?
Thank you very much. Today I am going to discuss about the traditional Indian medical systems and health knowledge in lieu of Shri Dharampal's work and the insights in comparison with current Government of India's AYUSH. There is a ministry named as AYUSH Ministry of Government of India, and I am going to try to compare the insights with the current government's policies. So I would like to first thank you everyone. I am Shri Namah. I would like to thank Nalanda University to give me opportunity and all the dignitaries on the dais and the chair. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guru Namah. So we have in India, we have a tradition, and we have a tradition of worshipping many deities, and one of them is considered as Lord, known as Lord Bhagwantari. He is also considered as the god of medicines and the god of Ayurveda, who is often depicted as having 4 arms, with one arm carrying Amrit Kalash or pot of nectar, which gives you immortality. He has a Shankha, he has a Chakra, and he has a Jaloka. Jaloka is a very interesting, it's an animal also known as a leech. It symbolizes the role, its role in healing, and it was very popularly used in traditional medicinal systems in India. And before the start of the actual presentation, I would like to administer a dose of second best medicine available. The best medicine is the one you never take. So I would like to give you second best medicine. Why did the allopathic doctor prescribe a vacation? Because the patient was tired of all the side effects of the medication. What is the allopathic doctor's favorite type of music? Anything with a dose of heavy metal. Why did allopathic doctors start a gardening hobby? Because they wanted to see some natural healing for once. And what did the patient say to allopathic doctor after receiving a huge bill? Doc, this prescription is harder to swallow than your pill. So many things have already been said. The modern medicine has its utility, but it also has some side effects and many things. It definitely has its utility. But we must also consider the importance of traditional knowledge, which can be integrated even today. Which is even relevant today. As you can see the image, you can see a dog licking his paw. Why would a dog lick its paw? Or many times we see that even when you have a pet, they try to lick you with affection. And it is we many times think that it is just a show of emotion, show of expression of love. But that is not the only thing. It is the show of expression of care. And we many times forget that there is a traditional knowledge and there are scientific studies which have proven that in our saliva there are enzymes which actually protect us from infecting bacteria and microbes. So there are microbicidal properties in our saliva, that is why many times when there is an injury we try to put it in our mouth, which is our natural reaction, and it gets healed, which we are forgetting nowadays. So this is the image you are seeing is of a bigba, also known as bilwa. So in my childhood, I am from a farmer's family. In my childhood, whenever there is an injury which is very painful, especially in the lower part of the heel, तो एट दैट टाइम हम लोग क्या करते थे, इसको गर्म करते थे। मेरे दादाजी मुझे बताया करते थे, माय ग्रैंडफादर यूज्ड टू टेल मी, इसको गर्म करना है और उसको जहाँ पे इंजरी है वहाँ पे यू जस्ट हैव टू काइंड ऑफ cauterize it and it stops paining and infection is gone. So these knowledge traditions were always available with us. The plant you are seeing, it is known as natal plant या बिछुआ का पौधा। Jungle में widely it is always available, and whenever we get in touch with this plant, we have some reaction because of the chemicals contained in that natal plant. But the trick is there is always a dog plant which is always just around the natal plant, which when you apply it reduces all the inflammation. So the remedies are always available with nature for many of the things. In that sense, we have always been self-sufficient as far as local traditions and primary care was always concerned. WHO has defined health as a state of complete physical, mental and social well-being and not merely absence of disease. But modern medicine and modern medical approach has reduced it just to see it as a mere body which is sick. We have forgotten other aspects of medicine. We have forgotten the inclusive aspect of our existence, our being, which need to be inculcated into our modern medicinal practices. So today I am going to discuss with the traditional Indian medical knowledge which has evolved over millennia, focusing on holistic health. It was based on mind, body and spirit, the inclusiveness of our own existence with the nature and the universe. And in lieu of Shri Dharampalji's work, which provided with the great insights and the factual data, in-depth data of the indigenous health system in pre-colonial era, and I am going to compare that with the AYUSH government's AYUSH policies, which is focusing on preservation, adaptation, and I am going to compare how they preserve, adapt and diverge from the traditional practices. So key works of Shri Dharampalji which I considered for this presentation is the beautiful tree, the book he has written, the Indian Science and Technology in 18th Century, and essays from Essential Writing and Rediscovering India. Shri Dharampalji extensively explored India's indigenous knowledge systems including healthcare in his books, and his research draw heavily from British records. Example, I'll cite only a couple of examples here which he included in his books. One example is hospitals in Bengal. The British record have recorded the existence of the hospitals in Bengal, which Britishers themselves availed the facilities for their own treatments. The another example I would like to cite here is widespread inoculation, the practice of inoculation, that is vaccination, prevalent in Bengal and South India, and there were indigenous medical tests which are still existent, especially Sushruta Samhita and Charak Samhita. The Siddha system itself has its own corpus of medical literature, which was scientifically developed literature, which is still available with us today. Shri Dharampalji's research provided me with the key insights that there was a prevalence of Indian medical knowledge systems, there was prevalence of hospitals, there were vaccination practices, especially he mentions about smallpox inoculation, the role of traditional healers which were available at each and every nook and corner, each and every village, gramas or dehats of India, the indigenous medical texts which were practiced and which were taught. There was a tradition of Guru Shishya Parampara, and the traditional Vaidyas. There was a properly developed system of passing this knowledge to the next generation. There was prevalence and the presence of indigenous surgeries, but impact due to the British colonial impacts, they marginalized indigenous medical systems and promoted Western medicine, suppressing the local practices. So Dharampalji's key insights were holistic. His focus was on understanding of the holistic healthcare, which was preventive, personalized and community driven. It was always in integration with the technology, and our practices were rooted in local ecological knowledge with a focus on diet, hygiene and plant-based medicines. Self-reliance, reliant framework was there. Local healers like Vaidyas, which nowadays we call them Ayurvedic doctors, provided accessible and low-cost healthcare at every corner of India. Current government India's AYUSH policies, AYUSH which is which is also known as Ayurveda, Yoga, Unani, homeopathy, naturopathy, and Sovarepa systems, which are traditional Indian health and medicinal systems, which are nowadays being promoted by Government of India with a focus on formalizing traditional practices. This is very important. So government is trying to formalize them into modern healthcare and integrating it with the global healthcare standards, clinical trials, and with the institutional research. This is the focus of the current government policies. And I'm trying to compare here with the Shri Dharampalji's insights about traditional Indian knowledge systems, especially with the healthcare, with current policies. So, healthcare approach, Shri Dharampalji, what he provided the insights was of a decentralizing nature, which was community-based healthcare system by local practitioners. Current government AYUSH policies are formalized and institutionalized. As far as the integration with local ecology is concerned, Dharampalji had a strong emphasis on using locally available medicinal practices and ecological knowledge, and it should be deeply rooted in environment and culture of the community. Current AYUSH policies focus on research standardization of the traditional practices, which might potentially reduce the localized ecological adaptation. Accessibility, healthcare was widely accessible to the population through local healers traditionally, but nowadays with the healthcare under AYUSH, it is formalized through universities and research institutes. Preventive care focus. Preventive care was always the key principle in our traditional medicinal systems, with focus on diet, hygiene, lifestyle, and deeply integrated into daily life. AYUSH currently emphasizes on preventive healthcare, but through programs, through government programs like yoga, Ayurveda, but it also focuses on integrating these health initiatives. But rather than community-driven approach, it is a centralized approach. Educational integration, healthcare knowledge was always part of the educational systems. AYUSH promotes it in more formal way. Adaptability and flexibility, the community adaptability in the healthcare was the key principle, and nowadays it is reduced flexibility seen in traditional practices. Role of traditional practices, local practitioners, Vaidyas, Hakims were central to the system, and in AYUSH policies, it is a professionalized and professionalized practice with traditional medicine requiring formal training and certification. Cultural knowledge preservation was always tied to the culture and social structures preserved through practice. AYUSH currently is formalizing all these systems rather than from a community-driven approach. So Dharampalji's view was traditional medicine was holistic, focusing on prevention and ecological harmony. AYUSH policies, the view is the goal is integration with the modern hospitals. For example, they are calling them AYUSH wings, but there is a potential risk of the dilution of holistic principle in favor of just symptomatic relief, which is the approach of the modern medicine. So how we can do that in modern day practices? So Dharampalji's insights were on holistic healthcare, integration with ecology, and self-reliant framework, which can still be integrated in the government AYUSH policies. We can use the prevalence of Indian medical systems, hospital and institutions, vaccination practice. Sorry. And Shri Dharampalji advocated for the self-reliant, community-driven healthcare rooted in ecological balances. AYUSH policy focuses on formalizing systems. So what can be done right now? There are two things that can be done. To build a sustainable future, AYUSH Ministry can draw deeper from the traditional practices outlined by the Shri Dharampalji and many other experts into this field, while adapting the contemporary challenges by adopting more flexible and local approach. Government of India should introduce mandatory introductory AYUSH discipline. This is what I feel. There should be mandatory introduction of the AYUSH disciplines with modern medical education. There is a need of development of a parampara or tradition in which medicinal practitioners from all fields, they have a healthy knowledge sharing and combined research at all levels, and AYUSH should be the part of STEAM or continuing medical education for everyone, for all the streams. And healthcare approach should be community-driven, bottom-up with emphasis on localized, affordable and traditional solutions, and it should be inclusive approach with physical, social, mental and spiritual with the best practices using traditional wealth of knowledge along with the modern science. So in India we use this prayer, Sarve Bhavantu Sukhina, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu Ma Kaschit Dukkha Bhagave. Om Shanti Shanti Shanti. May all be happy, may all be free from illness, may all see auspiciousness, may no one suffer in any way. So our traditional practices were always based on all inclusiveness. And with a last note, these are the things what I discussed, what government should do or how the centralized approach should be. I would love to discuss what I can do about it and what I am going to do about it. If anyone is interested in question answer session. Thank you very much. Thank you.